Hello, everyone. I'm Sherry Rolfing, your host of the ACAP Member Engagement and Retention Showcase. I'd like to welcome you today to our session presented by the Freespira team. They will be discussing hidden conditions, the members who cost twice play and spend. But before I turn it over, I have a few housekeeping items. This session, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines. These guidelines can be viewed on our website. We will record today's call and will post it and the slide deck on the Showcase website. Always remember, if your plan is seeking services, be sure to check out our list of preferred vendors, just like Freespira, at the top of our homepage. Just click on the preferred vendors link to see them all. You can also post a note or even an RFP on the preferred vendor connection portal. During today's session, you can ask a question at any time by clicking on the Q&A icon in your Zoom window and typing in your question. Now I'll pass it over to Joe to get us started.
Thank you, Sherry. And thank you, everybody, for attending. We're really excited to be here today. As Sherry mentioned, my name is Joe Perekupka. I'm the CEO of Freespira. I'll be the moderator for this webinar today. And, I think as we start this, I think what's important to share is as we've partnered with our health plans, we have encountered a common concern that we hear from them, and that's providing new treatment options and achieving cost savings can often appear contradictory. Our aim today is to examine a complex question. If the existing treatments that you're offering are not resolving the symptoms for your members, and there's a growing percentage of members that are going undiagnosed, what is the impact on a health plan spend? It's ironic that today is May 1st, or appropriate, I should say, because this is the kickoff of Mental Health Awareness Month, and we're very proud to be here. And as we begin, I think it would be awesome to have each of our panelists introduce themselves and a little bit about themselves. And Mark, if you want to go first, that would be great.
Thanks, Joe. I'm Mark Rakowski. I'm the president of Chorus Community Health Plans. We're a health plan based here in Southeast Wisconsin, wholly owned by Children's Hospital of Wisconsin. Cover about 115,000 members in the Medicaid program in Wisconsin, and also another 11,000 on the marketplace through the Affordable Care Act.
Great. Thank you, Mark. Malika, if you wouldn't mind introducing yourself.
Good afternoon. My name is Malika Closson. I am a double board certified adult and child and adolescent psychiatrist. I have over a decade of experience doing direct patient care with children and adolescents and their families, and I am a consultant to Freespira.
Thank you, Malika. And Mary Lou, please.
Sure. Thanks, Joe. My name is Mary Lou Mangan. I am a health analytics consultant, and I do some analytics consulting with Freespira. I have about 25 years of experience with healthcare data on the provider, payer, health vendor side. So really like digging into data, doing lots of outcomes research, looking at claims, looking at social drivers of health, doing some pre-post studies. So basically everything healthcare data is where I live.
Oh, great. Thank you, Mary Lou. And for everybody, just to kind of level set you what Freespira is at Freespira, we're really focused on shifting the paradigm of behavioral health care through our at-home treatment with indications for treating the symptoms of panic disorder and PTSD. So one of the things we decided is, and as you can see, we've got an incredible panel here with very different experiences that will shine throughout the webinar. But we felt as a group that to really frame this conversation, we need to begin by anchoring around the actual data. So as we begin, we're going to turn it over to Mary Lou. And Mary Lou, if you could share with the group, when you analyze the claims data from several health plans, what is it that you found that you think is compelling to share with this group?
Sure. Thanks, Joe. So as this slide shows, for one of the regional health plans that we looked at, we are seeing approximately 8% of the overall population that falls into this PTSD or panic diagnosis group. And then we also show about 28% of the population who does not have a claim. They don't have a claim for panic disorder or PTSD, but they appear to have one of those conditions based on their other claims. So they don't have the official diagnosis, but it looks like approximately 36% of the population has some level of PTSD or panic disorder. And what we're seeing that's really interesting in terms of the cost, the 8% of people that have the diagnosis end up costing about twice as much on average. If you look at the average cost for a member, those 8% of people cost approximately twice what the other members cost. So of course that's a little alarming in terms of cost, and so requires lots more digging. And that's pretty standard across health plans, with the percentages usually around 6, 7, 8% per this slide, with either PTSD or panic. And then again, the significant part of the population without the diagnosis, usually somewhere there in the high 30s or into the 40% range of people that are undiagnosed, but that appear to have either PTSD or panic disorder.
Well, I mean, that's really compelling data. In your analysis, Mary Lou, did you find there were differences between the individual members that were treated with Freespira versus those who weren't?
Absolutely. That's having looked at lots of claims data for Freespira treated members. I think if you skip, yeah, so this slide shows some of the outcomes in terms of the people who actually achieve a response. And what I think is actually really interesting is the third part of that last slide is the adherence to the treatment. I'm sorry, Sarah. And so the next slide actually shows a little bit of the savings data, which is that Freespira treatment. Here you can see on this slide, we looked at the median costs. So we're looking at costs from 12 months before the completion of Freespira treatment and the 12 months after. And you can see here just simple data going from the pre-treatment to the post-treatment shows about a 35% cost savings for the individuals who are treated with Freespira. And this is the CCHP data, but this is found for various other populations with whom Freespira works. It's usually a savings right in there, about 35% up to 40%, looking at a pre-post outcomes for the population.
Great, thank you, Mary Lou.
Mm-hmm.
So as we kind of shift, I'd love to turn to Malika, and based on your experience, can you elaborate on why you feel that these disorders have a higher rate of being unrecognized?
So I think the primary issue is just lack of awareness on both the part of the patient experiencing the panic or PTSD symptoms, as well as the healthcare system with which they interact. So the general population tends to continue to think that PTSD is only associated with military veterans or victims of assault. But what we see is that PTSD is actually fairly common. And so PTSD can arise from things such as natural disasters, similar to what we just recently saw with the devastation of the LA fires, which people are still attempting to recover from. Tornado outbreaks. PTSD can result from things like motor vehicle accidents or even invasive medical procedures. So what happens is people who are experiencing the symptoms of these disorders just aren't aware that that's what they're experiencing. In particular with panic disorder, patients generally experience a lot of physical symptoms, so shortness of breath, heart palpitations, dizziness. And so they repeatedly seek out physical care, not realizing that they actually have symptoms that are consistent with an underlying panic disorder. And so what we see is people suffer with these symptoms and these disorders, but they just aren't aware that that's what's going on.
Well, that's fascinating. And, as we kind of take, so thank you for that perspective from a clinician's point of view. And I think as we shift now, it's important to look at it from a health plan perspective. And one of the things, Mark, we've heard from not just you, but all of our partner clients is that you're kind of dealing with a multitude of conditions across your membership. So I guess there's a two-part question for you, and it's how does a health plan prioritize what conditions are most important to address? And then where does behavioral health fit into that prioritization?
Thanks, Joe. Yeah, I believe we are a data-driven organization. And so as a health plan, we obviously have a multitude of claims information. As I mentioned, we have two different lines of business, and the reality is they're very different. That Medicaid program is predominantly moms and kids, but over the last 10 years in Wisconsin, we now have a significant number of childless adults who are eligible for Medicaid. The marketplace plan, as I said, very different. 90% of our membership are adults. And so we stratify our data for each of those lines of business. We look at what is most prevalent in our population. And not surprising on the Medicaid side, it was pregnancies and maternity visits, maternity services, asthma in kids and adults, diabetes. And yet, I think, and behavioral health in general. And that has been a growing prevalence within our population, whether that was depression, other substance abuse. And candidly, I think until we connected with Freespira, we weren't even aware of the magnitude of the PTSD and panic disorders in our population. And Freespira helped us dig through that information. You see here, yes, 8 to 10% of health plan membership has those diagnoses, but it is honestly the undiagnosed members that we have found to be an alarming number of our members, an alarming percentage. And it is exactly what Malika said. It is members that are going to the emergency department with physical symptoms that seem to manifest themselves as cardiac care or cardiac needs, but ultimately don't get cardiac treatment. And they're continuing to go to the emergency department. And so for us, the data, I think, helped us engage with Freespira and helped us understand that this was really a segment of our population that we weren't providing support to. That those typical care coordination programs that we start weren't necessarily addressing the needs of this cohort.
You know, Mark, throughout, as you were talking there, one thing just kept coming to my mind, and that's that you're really in touch with your membership. How is it that you go about gathering the information necessary to maintain that close-knit relationship with your members?
Again, the claims are telling us one of the stories. For us, it's a combination of that and health risk assessments, health needs assessments that we're attempting to do with all of our new members, understanding what their social needs are, what their gaps are. That is not an easy task. And I can, honestly tell you that I wish more of our members would be able to, would share that information with us. But then we also have focus groups. We have a group of our members who connect with us on an ongoing basis and share with us what's going well with the programs we offer, what we might be missing, what for them in particular is something of interest. We also talk to them about how we best could communicate with them. And I think that's probably part and parcel with the success of programs like Freespira is how do we get engagement and how do we get members, how do we make them aware of the programs, how do we get them interested, and how do we get them to continue with services that are being offered. And so that focus group helps inform us, right? We have really moved away from mail, US mail as our prominent way of communicating with members, to texting and emails and sharing information at community events and working with providers to promote services that we offer. And I'd like to say it's really any and all of the above are what we've learned. We need to try.
No, and that's really important. And I do recall when we first began, your entire team is really focused on, it's not just offering it, but how can we get the message out? How are your members going to receive that information, embrace it, and understand that it's a real option for them to explore? One thing that you did say in that, in your discussion was, you mentioned comorbidities such as asthma and diabetes as you're looking at different segments of the market to address with your members. Mary Lou, when you were looking at the data in your analysis, did you notice any interesting comorbidities with these disorders, whether it's chronic conditions or even other mental health disorders?
Yes, and I think that's one of the interesting parts of looking at the data. And as Mark is talking about the members and the variety, just the ways that things come up, and then how to reach out to those members. Some of the things we see, we talked quite a bit at the beginning about the undiagnosed members, but some of the other conditions that we see might include asthma, substance use disorder, major depressive disorder, anxiety, like a general anxiety disorder. And so we have done some work also looking at groups of the population that have different comorbidities, whether they have, sometimes, you could have a PTSD diagnosis along with one of those. But like you said, Joe, sometimes there's not a PTSD diagnosis or a panic disorder diagnosis. One of the things that we had looked at with the CCHP population was the prevalence of chronic conditions. And we're seeing a higher prevalence of many other chronic conditions, everything from asthma to psoriasis with the treated members versus the general population. And we've done lots of analyses of these. One of the things we worked on was looking at the inhaler spend, like the pharmacy claims for the population with asthma. And I'm just looking at my data here, but like broken down by age groups, we see, again, from a pre-PMPM to a post-PMPM, looking at 12 months pre and post, anywhere from a 38% decrease to a 57% decrease when you're just looking at the inhaler prescription claims over time. So I think there's a lot happening there that's not just for members with panic disorder and PTSD, but there's a greater effect sometimes for members with other conditions and other costs.
Fascinating. Thank you, Mary Lou.
Mhm.
It's Mark, you mentioned something earlier about, looking at the data and always using that as kind of your source of truth. But I want to shift now to Malika. So in real world experience, and one of the things you mentioned, Mark, is making sure that the providers are involved. From a provider perspective, when you look at this, how important is the data versus what you're experiencing in terms of the individual sitting in front of you? And are you bringing in any data to help kind of shape your treatment decision?
So yes, I mean, anytime you're working with patients and trying to provide evidence-based care, you want to look at data to support best practices in what you're doing. The other piece of it is that, particularly when you have patients who are sort of going through sort of standardized treatment but not getting better, you really need to assess if there are alternative treatments that are effective that might be beneficial to those patients. So yes, data is critical to everything we do in patient care.
Excellent, thank you. And I personally, that resonates with me. I mean, one of the big things that we're constantly pushing our team to do is we need to make decisions based on data, point us in a direction, because that gives us a foundation which we can kind of branch off of. And that's the best way. And I love kind of hearing you say that, Mark, because, well, for us especially, I mean, Freespira's had the great fortune of working closely with CCHP and specifically Mark for the last several years. And hopefully you've seen that Freespira, our goal is to truly partner with our health plan clients with a goal of delivering consistent clinical outcomes, cost savings with a strong ROI, but truly ensuring the member has a positive experience. I'd love to hear from you, Mark, based on the last several years. What would you say is the most notable part of CCHP's partnership with Freespira?
Well, the engagement levels that you see here, the adherence, and really the improvement, the stickiness, I guess I would say, of the treatment. While this is a 1 month or a 28-day course of treatment, we have seen over 1 to 2, 3 years members continuing to report improvements in their underlying symptoms, reduction in their underlying symptoms. I'd say one of the other things that's really important to us in that relationship with Freespira is the Freespira's ability to really engage with our members and create marketing material and outreach material that resonates. And it's, again, I think that cohort that is undiagnosed, we've seen some really creative ways of triggering, and I don't mean that in a negative way, those members to think about this and maybe put 2 and 2 together that those symptoms that they've been experiencing and going to the emergency department for, there may be an alternative for them. And it may be something that it obviously then doesn't include pharmacological engagement. It is something that they can do in the comfort of their own home, very easy to access. And for us, then Freespira takes that burden off our care managers or care coordinators, as the Freespira team vets people, explains to them what the program entails, makes sure they can comply. There They're in a good space to do that. They've really taken that burden off of us. And then if needed, they can refer members back to our care coordinators for other services that they may be aware of or in need of.
Excellent, thank you. And there's a couple questions that came into the panel, so I hope you don't mind, but one that, as we see these questions coming in, I think it's relevant to what we're talking about. I'll just bring it into the group if that's okay. So one question just came in, I think it dovetails off of what you were talking about, Mark, is how can we improve care for our members with behavioral health concerns who are in the ED frequently?
It's a matter then of finding them, outreaching to them, right? We know who those frequent flyers are. I think all of the health plans probably have programs that are designed to connect with those members. And so I think it's a little bit of awareness of our outreach teams that while someone is, again, going to the emergency department for what looks to be physical conditions or physical symptoms, that we need to dig a little deeper and make sure that our teams are asking the right questions when they connect with members, and making sure then they're aware that an alternative like this is available.
Oh, that's fantastic. And I love the focus on digging a little deeper. From your perspective, Malika, in your experience, same question to you. I mean, when you have those, as Mark called them, frequent flyers to the ED, any different, any ways that you've deployed in terms of trying to help encourage them to get the help they need?
I mean, I think some of it sort of depends on the presenting problem. But I think in general, for patients who are presenting to the ED, the first thing is to really find out why they're presenting repeatedly. So is it that they're not in treatment and they need that quick linkage to treatment? If they are in treatment, there really should be some sort of assessment about what it is about your treatment that isn't helpful to the point where you continue to seek out the ER and feel that you need to seek out the ER. Once you sort of assess that, you can determine if maybe there are alternative treatments that need to be explored, or as Mark said, does this member need care coordination or peer support or some other support services built in around them?
Fantastic, thank you. So, Mary Lou, when we looked at the cost savings earlier, I know you've done a lot of digging in on the CCHP cost savings data. Is there anything that you saw in terms of data that you want to share with the group from year one versus year two? Do you notice any trends?
Sure. So we've talked specifically about CCHP and the 35% cost savings. We have looked at the costs in so many different ways. We compare the treated population to the untreated population. We've done some matched pair analysis. We look at, PMPM over 6 or 12 months. I guess the biggest story is that there's always a savings. And so sometimes we look at medical and pharmacy for the total cost of care. And for one of the other health plans for which we have done a similar analysis, their savings was about 43%. So looking over time. And I think a couple of the other things that I would like to call out that I've seen in the data is the consistency and the fact that the savings hold up over time. It's not, I mean, I think about myself and some of the things I've been offered at work over the years, like take a health assessment and get, a gift card or some kind of a monetary reward. And I think that a lot of the times for me, it has been a one-off and it doesn't necessarily change a habit that needs to be changed. But I think when I look at the Freespira data, it's having an effect, soon after treatment, but that holds. We've looked at 24 months out, 36 months out. And I think one of the most important things is that the savings actually hold up. So the savings continue past just the 12 months, which is a really big deal when you are looking at this kind of therapeutic treatment for people with these pretty expensive conditions.
Great, thank you.
Mm-hmm.
So we have another live question that came in, and I think this is a really powerful question. So the question is, how do you see Freespira working in concert with with other health solutions out there, especially for patients who have multiple comorbid and chronic issues, to augment overall health support? I don't know, Mark, if you want to tackle this first, and then I can add my perspective.
Well, yeah, I'll try to. And maybe this is better for a clinician as well.
Yeah.
When we obviously have members who are engaged in long-term therapy, and as I mentioned, pharmacologic support. For us, this isn't necessarily a replacement. This kit is an alternative, and as our medical clinical leadership looked at Freespira several years ago and evaluated this, it's very low risk. It is a short-term engagement. We will know very quickly if someone is able to complete the treatment, and based on, again, their symptoms and reporting of that, whether this has been successful. The claims say that the dollar savings is great, and as Mary Lou said, we're seeing this not only in year 1, but year 2, but year 3. And again, we have to recognize this isn't for everyone. So we continue to make sure that a multitude of services and support are available for our members, including telehealth therapy services, right? We have in-person, we have now telehealth alternatives, we have digital therapeutics like Freespira, and we have to know that one size doesn't fit all. So it's again another tool in our tool belt. I know we say that kind of thing a lot, but it's true that this is something that, and in our case, we have almost 1,000 members that have engaged with Freespira. I think that's an amazing number, given our relatively small number of total enrolled lives. So this has been something very successful, but it isn't for everyone. It's for the right person who can engage with it.
Yeah, that was fantastic. Thank you, Mark. And Malika, from a provider perspective, how are you weighing, or how do you see this in terms of comorbid chronic conditions, and then obviously Freespira is a behavioral health treatment?
So I think that, standard treatments are wonderful. The problem is that not everyone has access, especially ready access to standardized treatments. So a lot of times there are long wait lists to get into therapy. The other issues are that some people, their symptoms are so severe, it's very hard for them to participate in therapy. And so I see Freespira as sort of coming in and getting those acute symptoms under control such that patients can actually effectively engage in standard treatment. And then thirdly, some patients just do not want medication. So some patients would prefer an alternative option, and I think Freespira is a great alternative option. I think the bottom line is that patients really need to have options when it comes to their treatment so that they are able to choose the treatment that works best for them.
Great. I love the way both of you have shared your perspective on this. I mean, internally, this is something that we spend a lot of time on, and going back to the data and looking at it. And at Freespira, with our analysis, we have looked at not just the impact in the behavioral health space, specifically panic and PTSD, but as we notice trends within the data that we're looking at with our partners, we begin to monitor them closely. And a couple of things that kind of jump out at us is we're realizing that, especially for panic disorder, it often is very high. There's a higher rate of undiagnosed patients because it does sit behind a chronic condition often, whether it's IBS or another condition. We've really kind of dug into that, and we've noticed some significant trends, especially with comorbidities, and whether it's sleep apnea and PTSD, there tends to be a strong interlink there, or asthma and panic disorder specifically. So when we look at things like that, we do look at the global consensus where we're seeing trends, but also it's really feeding into this whole concept of bidirectionality, right? So whether it's cardiovascular events, asthma, other chronic conditions that we're seeing this tight relationship between panic and PTSD, our goal is to help bring that information to our health plan partners and try to arrive at if there's a different strategy we can deploy to help get the people the help that they need. Because the one thing is if we're only addressing one side of the equation and that other side is not being treated or addressed, appropriately, it's only going to continue to, to plague that individual and drive up costs for the health plan. Another question that came in is, what is the process of evaluating the program? How do you work with your clients on this? So I think I can take that, and Mark, if you want to jump in. The process of evaluating the program is something that's built out from the beginning. I think obviously Freespira is deploying measurement-based care with all of their members that are enrolling in the program. But we do quarterly business reviews with all of our health plan clients. And, I kind of share the story. When we first launched it, we're talking to a health plan. We're like, we're going to do these quarterly meetings. You can kind of see them with a raised eyebrow, like, all right, I'm really busy. And is this really going to be worth my time? And usually we get to that first meeting. And before that first quarterly business meeting is over, we hear from the individuals on the other side, our partners. They immediately want to schedule the next 2 or 3 for the remaining year. And we start pulling in more and more people to these meetings. And the reason is because for the first time at these quarterly business meetings, we're sharing incredibly valuable information back to our health plan partners. And part of it is aggregated clinical outcomes from all of that individual health plan's members that went through the program, adherence rates, as you saw on that one slide. We will do cost savings analysis twice a year. But I think where I've seen the greatest impact in terms of evaluating is the patient satisfaction scores. We assign an NPS score for each of our health plan clients for the members that go through, and the patient testimonials. And I think, Mark, you alluded to it earlier in terms of how you're prioritizing disorders that you're trying to tackle for your members. One thing I think that's incredibly powerful is the testimonials. Like oftentimes health plans aren't exposed to the suffering that the patient or their family is dealing with when it comes to a mental health condition. When you hear the impact that this treatment has had on that individual and or the family, it's really powerful. But I don't know if there's anything else that you'd like to add to that, Mark.
I'd love to. I sit here and I'm not a clinician, and I'm not a case manager. I don't have the pleasure of helping people manage their journey through the system. But the testimonials to me, the fact that this is a life-changing treatment for these members, it's amazing. And it is something that we share with all of our staff, not just our behavioral health team. We share it with our financial analysts. We share it with our admin assistants, that we as a health plan have the ability to change the trajectory of someone's life. And people that have not been able to go to their kids' school for concerts for years, and now are doing that, or their sporting event. That also helps us, I think, back to how do we engage people? Well, this is part of the marketing process. I think some of those testimonials obviously will resonate with people who've been struggling and who haven't figured out where to turn yet in terms of, what do I do now? So that to us is just kind of the cherry on top, or the icing on the cake, beyond the cost savings and the reported outcomes. It is those testimonials.
Oh, fantastic. Thanks for sharing. And I appreciate it. And we've seen it, and I've seen first, Mark, just your team and how moved they are by these testimonials. So it's good to hear that from you as well. All right, we're getting a lot of live questions in here. So I'm going to get to the next question here. The question is, does each health plan figure out the number of ER visits that will meet a threshold in order to refer someone to Freespira? So I will take a first stab at this, and then Mark, anything you want to add to that would be great as well. I don't think there's a number of ER visits. We're not looking at that as kind of a driver to whether they meet criteria to be part of the program. I think we're using the ER data and the visits as a driver of how large a problem might be present within that given geography or the membership rank. So for us, we're looking at the entire claim set, as Mark mentioned earlier, to arrive at which members are suffering the most, who meet criteria and will have the best benefit, both clinical primarily, obviously. We also look at characteristics for, will they be adherent to the treatment? And then the last piece of that is, can there be a potential cost savings back to the health plan? But I don't know, Mark, if you have a different way to answer that.
No, I would have answered the same way. There isn't a magic number or a threshold. I will say this, that we do provide our claims data to Freespira, so they're able to then use what I'll say is their algorithm to figure out the diagnosed and the undiagnosed, and the ED visits play into that. But we have had members who've engaged in the treatment that weren't even in the undiagnosed bucket. We've made all of our members aware of this, and a little been, again, a little tailored. We have tailored communication to members who've been specifically diagnosed with panic disorder or PTSD. We have other communication to that potentially undiagnosed, and then just broad awareness to all of our members that this is available to them at no cost. And members have come forward who weren't in those initial buckets and have benefited from this. So they may not have had any emergency room visits yet.
Yeah, and that's so important to mention, Mark. We do see it happens a lot, is somebody else may get the information and they know a friend or a family member that's also in the plan that could benefit from this, that are suffering from the symptoms. Because a lot of the communication, and this has been part of the incredible partnership with CCHP, is learning how to communicate to members is incredibly important. Focusing on symptomology as opposed to the disorder diagnosis is really been an important lesson that we've learned. So here's a great comment. This is going to go to you, Malika. Question is, they asked if you could comment on the current standard of care with medications, and do you find benzodiazepines are still frequently used? Is there value in using Freespira in place of initial acute medications?
So standard of care for treatment of both PTSD and panic disorder involves a combination of therapy and medications. I think that benzodiazepines have sort of fallen out of use just due to adverse side effects. You have the risk for dependence and abuse. You have the risk for withdrawal. And so benzodiazepines do not tend to be a first-line treatment. Antidepressants, SSRIs, tend to be first-line treatment in conjunction with therapy. And I do see Freespira as being important and valuable in initial treatment versus medications. Just number one, like I mentioned before, some people just don't want medication. The second thing that I also mentioned before is that a lot of times, particularly when you talk about PTSD, therapy consists of patients sort of processing their trauma with a therapist. Sometimes patients' symptoms are so intense and severe that it's very difficult for them to engage in that initial therapy. And so, as I mentioned before, I just see Freespira fitting in as sort of an initial treatment for maybe patients who either don't want medications or they just can't sort of conceive of being in therapy and being able to tolerate therapy at that time. And then they could complete the Freespira treatment and then maybe move into standard treatment such as therapy.
Really appreciate that, Malika. And I think what I heard you say here, and I know that you're a big proponent of this, is, it's not to say that standard of care shouldn't be looked at first, but we also have to find a pathway. It's about getting the individual to engage in any form of care, and giving them options sometimes is what's best.
Exactly. It's so important, like I said, for patients to have as many options as possible so that they can sort of pick the treatment that they feel works best for them. Excellent.
Appreciate that. Thank you. There's a couple other questions here, so I'm going to keep going through them. One came up here, is there a billing claim code for your service that is used? I can field that one. We are typically using HCPCS code A9291 where appropriate. Or we can also use E1399. But if you're interested, we can talk through that. We can be pretty flexible in terms of how we're partnering with you and making sure that we can bill as a claim. One of the big things that I think is important to note for Freespira is we are HQAA we are CMS accredited through HQAA, which gives us the opportunity to bill the health plan directly, and then also we're DMEPOS accredited through that allows us to ship the product directly to the patient. All right, a couple other questions that came in here. Let me scroll up. So an interesting question came up is there a process in place to monitor these conditions as they develop? And I think maybe Malika, if you want to kind of tackle that one, that would be great.
I'm sorry, Joe. I don't really understand the question. And
I guess they're asking, is there a process in place to monitor these conditions as they develop? So maybe the better way to look at it is, can we catch it at an earlier stage of the progression of the disorder for the individual?
Yeah, I think that we can, and part of it is through data analysis, like what you've done here is to sort of search for patients who may be having symptoms but aren't necessarily diagnosed. And then, what we do know is that, particularly with PTSD, a lot of folks are undiagnosed just because, again, they're not aware that their symptoms align with the diagnosis of PTSD. So I really think the key is like honing in on those undiagnosed members who are still suffering with symptoms and kind of identifying those and addressing their symptoms through treatment. I hope that answers the question.
Yeah, I think that answers it pretty well. Thank you. Another question that came up here, and I think maybe Mark, you're best suited to answer it, is their goal is to get CAP's NCQA star score of 5, and are programs like Freespira helping you work towards that?
In theory, yes, but I also think the reality is our CAP surveys, member satisfaction surveys, in our case, we might have 500 people who've responded to that. And certainly the child survey then has a far smaller number of adolescents who are eligible for this. So yes, it should, but I think there's probably a pretty small overlap when all is said and done between the number of members who've engaged with Freespira treatment and the number of members who actually respond to that CAP survey.
Thank you. That's important to note. All right, moving on to another question here. This one is probably geared more towards Freespira, but Mark had touched upon a lot of the answers here, but curious about how to improve member engagement for programs like these, especially toward Medicaid audience. I think initially, as Mark stated, we've really partnered with CCHP and the marketing team to understand how they communicate to their members, what channels they've found to be most effective, and then really building our messaging around that based on previous experiences they've had, and then bringing our knowledge base to the table as well. I think Medicaid, our approach in all of this and what we've done as an organization, I like to say, as we get more sophisticated as a company, we're bringing in a lot of new information. The first and foremost is there are certain requirements in terms of addressing Medicaid population, making sure that the way you message to them kind of meets the way they can receive information, that you're not talking over their head. As medical device manufacturers and companies that develop treatments, we get very excited about all the data that we've done and all the studies that we've done, but that you have to be able to translate that into a lay person to be able to understand. So one of the things that we spend a lot of time with is each member that goes through the Freespira program is paired up with what we call a care specialist or a coach. They're not practicing any type of medicine, but they're there as a partner for that member through this 28-day journey. Throughout that process, we're now actively engaging the coaches to inquire with the members, what is it that encouraged them to seek out more information on Freespira and enroll in it? What could we have done differently or better? We take that information and bring it back into the company, and then utilize that to actually improve upon the process for how we're doing outreach, what channels work best, whether it's SMS or direct mail or email, and then also the messaging that we're doing. And from that, some key things that we've really learned is the differences in the way you market to a Medicaid population versus a commercial population, gender preferences in terms of messaging around how you describe symptomology and what's important to them. So all of that is coming back in, and it's a constant evolution from our perspective.
So I'll add to that if I can. Freespira, as they engage with members who have expressed an interest or are asking questions, is able to track down then how did they hear about this, right? It is self-reported, but then tracks what was it email? Was it a direct mailer? If so, what was the time frame of that direct mailer to see what kind of message necessarily resonated? So that gets tracked, and we can see then on a quarterly basis what's the best way to connect with members at that point. it's typically email. It is also direct mailer and then a little bit of the actual text messaging. The other comment I'll make is obviously every state is unique. And in our case, we do need to get that member outreach approved by the state as part of our marketing plan. And so we work with Freespira and we engage our marketing team with theirs to make sure that we communicate at the right level and that everything we do is approved by our Medicaid department.
Yeah, that's important to note. Thank you, Mark, for highlighting that. All right, I think we have one last question here. In a health plan population, what do you think is the estimated number of members that this country, hang on a second, it's coming in a little bit. In a health plan population, what do you think is the estimated number of members that would benefit, or percentages? I'm sorry, it's coming in multiple parts, that this country is used for percentages for these disorders. So from our perspective, and then, Mark, you can comment if you have something different. What we're looking at, and it's actually really consistent across all lines of businesses, regardless of whether it's Medicaid, Medicare Advantage, or even commercial populations. We're finding a pretty consistent breakdown for diagnosed and undiagnosed. On average, it's going to be roughly 8% of the population will be diagnosed with panic and PTSD. And then the undiagnosed portion, it's a tight range. It varies a little bit, but as you can see here, that's usually somewhere between 2 to 3x of the diagnosed population. One of the things that we've been pretty fascinated about is the consistency in which the diagnosed members are, right? It's usually right around that 8%. Where we see variances is often the mix of PTSD versus panic, and that's where things are really different. But for the most part, very consistent. I don't know if you've seen anything different, Mark, or anything you want to add.
I think just a general comment. Again, it will depend on the average age of your Medicaid enrollment. What's the eligibility for adults in your state? In Wisconsin, we cover adults up to 100% of the poverty limit, including childless adults. And so this treatment is geared toward adolescents and adults. In that population of kids age 0 to 10, this isn't the treatment for them. So that percentage will vary depending on your Medicaid eligibility.
Yeah, that was I really appreciate you sharing that. All right, so as we kind of come to the end here, I have kind of one round robin question I'd like to ask the entire group, and that's that if there's one thing you hope that our audience of ACAP members walk away from this presentation and take with them, what would that be? And why don't we start with you, Malika, first?
So I think the main point that I'd like to make is that behavioral health conditions are more common than most people typically think. And they do have a pretty significant impact on things like day-to-day functioning, ability to engage in things that, people need to do and enjoy doing. And they also result in, if untreated, can result in increased healthcare expenditures, as well as, increased healthcare expenditures, as well as difficulties in functioning across the board.
Great, thank you, Malika. Mark?
Echoing that, these are debilitating conditions that I think we don't even understand the impact of or the prevalence of. And for us, again, the comment was made that there's a lot of different ways that people can engage in treatment. This is an option, and it is fairly low risk, if not very low risk. It is very convenient. It is something I think that for many people, the stigma of behavioral health and mental health is something that limits their ability to access care. This is done in their own home, and within 28 days, they are seeing dramatic changes in their life. So for us, it's a great option. It's a great alternative. It's not going to be for everyone, but Freespira has been a great partner in helping us down that on that journey to offering more accessible care.
Thank you, Mark. Mary Lou, anything you'd like to add?
I think just piggybacking off what was just said, I think two important things. One is to meet people where they are. Again, just for a variety of reasons, like Malika said, people might not want to take medication or want some kind of option that they can do at home. And I think the other thing that we've looked at here in terms of the data and also the testimonials, every once in a while I get to see those come through at Freespira, and it's that it works. It is proven, I think, in terms of the black and white data, but it's also, as we've talked about quite a bit over the last 20 or 30 minutes, those activities of daily living. You think about people who can't leave their homes for whatever reason, and Mark touched on, being able to go to your child's school events or maybe a sporting event. The things that are primary, like the costs and the utilization, can be obvious and they can be measured in black and white data. But all those other downstream effects are such a huge part of this, and why I love working with the Freespira data and seeing the positive results, but then just also thinking about those people. It's, one person and their life has been positively impacted, and then the effects of that, I feel like are, it's a ripple effect, and it feels good as a non-clinician in healthcare to know that there's a company doing such good things.
Thank you, Mary Lou.
Mhm.
Yeah, and I think what I've heard from everybody on this is really it's about access to care, and I personally think that everybody is at some point in time touched directly or indirectly by mental health and the challenges that it can present for an individual or a family. I see, unfortunately, I think sometimes access to care is really, really important to us at Freespira, and we're trying to kind of fill in the gap, between what is traditionally the treatment pathway for individuals and trying to provide different options. And I feel we're at a point where we need to kind of change our mindset and really shift away from where we get stuck in that standard of care only option, and realize that we should always lead with that. But the mindset shift has to come from, but if it's not going to meet the patient's needs, or they're not going to engage in it, then we have to be very quick to offer them additional options. And I think that's the key. And you heard Malika say it earlier. You've heard Mark say it. I think the key here is, try to get individuals to engage in any form of care for their disorder, so that they can get some relief and provide a good patient experience. Because based on that, then we see individuals become empowered to take a much greater role in their own healthcare, and they'll seek out and continue good positive healthcare utilization. So I would like to say thank you to everybody on the panel. I really appreciate it. Appreciate everybody that attended. The questions that came in were fantastic, but special thanks first and foremost to Mark and the CCHP team. We use the word partner a lot in this, and it's something that we're really proud of. We see ourselves as an extension of the brand, and we really value the partnership that we've had with Mark, and a special acknowledgement to Mark, because for an individual at his level as an executive in an organization to be as involved in a program like this, it really sets the tone for the entire organization. So thank you, Mark.
You're welcome. Thank you.
Thank you to Malika for your perspective as a clinician. It's always important to hear that, and really appreciate your insights today.
Thanks.
And last but definitely not least is Mary Lou. Going through all this data and looking at it and looking for trends, it's so important. And as you heard, Mark started originally, it starts with the data. They're always looking at that. So thank you, Mary Lou, for the efforts that you're doing and looking at the data and making sure that it aligns with our partners' goals as well as internally.
Thanks, Joe.
And for everybody, as Sherry shared with you, this is being recorded. The slide deck, everything will be available. But if you want additional information, you want to learn more about Freespira, you can go to our website, freespira.com, or feel free to email me directly at joe@freespira.com. We're here. We'd love to talk to you. And any way we can partner and help you and help your members, we're really open to it. And again, like I said, we'd love to have a conversation and see if it's worthwhile. Thank you, everybody. Have a wonderful day.
I want to thank the Freespira team for today's session, and actually I want to thank the audience too for the great interactive questions that were happening. As a reminder, as Joe said, this has been recorded. It will be posted on the Showcase website. Just go to the main communityplans.net ACAP page and click on events. You'll be able to find the showcase there. And everyone have a good day. Thank you.
Thank you.
Thank you. Bye.
Bye.